My name is Bern. A regular gynecologist tried to figure out where all this pain was coming from and why I was having all these problems, and they couldn't figure it out. So they did an exploratory laparoscopy, and that is what showed the endo. Actually, the word endometriosis never came up until after they operated on me. Nobody had even thought of it, and then they operated on me, and they were pretty much like, okay, we burned it, and so you're fine. I'd say I had about 2 to 3 months that I was after that surgery, and then I had gone back to them, and that office pretty much informed me that they wouldn't do anything else for me because I had decided against the Lupron injection. So then I started searching for another practice. So the search landed me with a doctor at a prominent New York City hospital. I didn't have a good experience with it. At that hospital, it didn't really seem to click. I feel like a really important part of being treated for endometriosis is the doctor-patient relationship. And I feel like I just wasn't believed at all by that doctor. So it took several months of convincing and trying different treatments and other things before they agreed to operate. So we worked on a lot of different things, but unfortunately it didn't really resolve any of my pain. And then I got fitted for a coil at my postdoc to try to help it out, but I didn't have really any relief from that operation. So before seeing Dr. Seckin, the other hospital had me on a lot of medications, which my family wasn't a huge fan of, and it got to a point that I really didn't think that they were helping me, so I just kind of stopped them all. They weren't helping my pain level. It got to a point where I saw that myself, so I just decided to stop them. But I was having pain daily. I was lucky enough to meet Dr. Seckin, and he's just very understanding and very knowledgeable about everything that was going on. He never seemed to question anything that I was feeling in terms of pain and how I was doing, which is something that I really appreciated. I like the way that Dr. Seckin runs his practice. I think he does a really thorough review of everything that's going on. He did an internal exam and a sonogram and reviewed all my records at my consult, and then sent me for a pelvic MRI with contrast. And then it just kind of continued in steps. But the thing that I really like about him, I have to say, is that he doesn't try to hide anything, or he doesn't say anything that he doesn't believe to be true. He really just only speaks what he knows and what he thinks, and I feel like that's not so common anymore. The previous surgery that I had, it was only the one doctor, or I had at my diagnostic, there was 2 of them, but I didn't have like a colorectal surgeon to specifically check what was going on in my bowel. And with the history of the bowel disease, that was something that I was really concerned about. And there was a urologist in my surgery to check everything, and I had gone for a consult with a cardiothoracic surgeon as well to discuss all my symptoms. So I think the team approach really works because it gives the chance for everybody to kind of look at their system and make sure that everything is working the way it's supposed to, because the disease can just kind of go everywhere. The day of my surgery at Lenox Hill was almost kind of surreal, I guess. I was very excited for surgery because I knew in my heart that there was still endo there, and there was something in me that knew that I would wake up feeling better. So I was very excited about it. But we drove in, and we got there at, I want to say like 6 or 6:30, and then surgery scheduled for 7:30. I think I went in at 7:45, so it was pretty well on time. The best part about Lenox Hill, I have to say, is like all the nurses know what endo is. I had gone to the emergency room at one point for the pain in my chest, and they all knew what endo was. And I thought that that was awesome because I've never, ever had a hospital experience like that before. And then, I mean, we were set to go. It was a pretty quick pre-op considering for the day I was in the hospital. And, I mean, everybody was really nice to me. They let my mom and my dad and my best friend come and sit with me. And then I got to talk to all the doctors and sign all the consents, and then off I walked into the OR. I knew when I woke up that the pain that I was having was surgical pain, not endo pain. So I was pretty thrilled. And they checked my bowels, they checked my kidneys, they checked my bladder, and they pretty much looked everywhere. They removed from my pararectal region. So I mean, it was a job, but I'm happy that they got everything that they could, because that was always what I wanted. They removed the coil that I had, and that was the majority of it. It was a lot of work, I'm sure. What's up? I think I'm doing pretty awesome. I feel pretty good. I was able to walk around the hospital the night of surgery, and I started doing yoga at about 2 weeks post-op, which is crazy to me. And I've been able to start losing weight now, and I'm feeling pretty good. I'm in my regular jeans instead of maternity jeans, which was like a huge deal to me. And so it's doing pretty good. It's baby steps, but it's getting there for sure. My best advice that I have is that if you have the opportunity to go see an endo specialist, you really should do it. Whether it's your first surgery or your 30 millionth surgery, I think it's really important to get the excision surgery with a specialist, because they're used to seeing different forms and they have all this education, all this knowledge behind them. And I think that it's really the best bet to get all the endo and to increase the quality of life and start to live without pain again. Be through excision surgery with a specialist. So because of everything that I had been through with endo and where I was, right before my second surgery, I created a company called Knockout Endo, and we're currently in filing for nonprofit status. And the main goal of it is to provide some type of financial aid for women to get excision surgery with the specialist that they need, because it is so expensive. And I'm thrilled, honestly, that I created that mission for us, and we're going to work on educating others and just making sure that women get the treatment that they deserve, because every woman deserves to have a high quality of life and a life that doesn't have pain. And the greatest hope that we have right now for that is through excision surgery. So that's definitely our main mission, would be to get financial aid for women that need it, so that they can get the surgery and get their lives back. More information about Knockout Endo could be found on knockoutendo.com, or on our Facebook page, which is facebook.com/knockoutendo. And we're on Twitter as well at the handle @knockoutendo.